In India, every year, 300,000 patients get end-stage renal disease, which requires some form of renal replacement therapy, either dialysis or a kidney transplant. However, less than 10% of those patients have access to care which they need to stay alive. At DaVita NephroLife, we want to change the way kidney care is delivered in this country.
In India, till some time back, the concept has been that patients come to their dialysis unit that is attached to a hospital. Now here, we have standalone dialysis units that are not attached to any hospital. So the patient just comes here, gets the dialysis done and goes back home. Now the idea is that our dialysis patients should be made as independent as possible and they should lead a normal life as much as possible. So dialysis patients should not be considered as patients. Hence, it is not always mandatory for them to come to a hospital center, set up and get their dialysis done. The idea is proper rehabilitation and to reinforce the feeling that dialysis can be done on an outpatient basis and that they are normal people.
This chronic kidney disease or end-stage renal disease, what we call it as, is becoming an epidemic, mainly because of increasing prevalence of diabetes and increasing prevalence of hypertension.
Here we approach as a whole, as a team. So it gives a spiritual and holistic approach to nephrology. Not only the clinical care, apart from that psychological and the dietary, the nutritional aspect, and as a holistic approach, it gives a complete and comprehensive care to nephrology.
We started DaVita NephroLife in 2009 with a mission to improve the quality and longevity of life for patients who need kidney care.
DaVita is a national company, US-based company that has been in existence as DaVita for about 11 years now. DaVita means he, she gives life. It's an Italian word and it really talks about the value of what we bring to patients every day. I feel very strongly that DaVita truly will make a difference here in India.
As you all know, this is a very young organization, very much committed to quality of dialysis and the care of kidney patients in general. What we have done is we have created a setup where all our doctors are committed to standard quality care. So generally our care involves state-of-the-art dialysis facility. We give considerable amount of attention to our water quality and water purity. The other important additions to our dialysis is all the data of our dialysis patients while being dialysis continuously monitored or streamed through the internet so that every physician who is involved in the care of the patient can actually look at these data and do whatever is necessary for them.
Monitoring of patients at DaVita NephroLife is excellent because we have each individual who is working on patient's hemoglobin and patient's KT/V ratio. So each patient is given attention to that. In the end, we call the patients to tell that where we have to improve. So I think these are incomparable compared to other centers where we have worked previously.
बहुत तकलीफ था, मैं चलने नहीं आता था, इसलिए इधर आके कुछ चल सकता है, कुछ खा सकता है, उसके बाद कुछ वॉक करता है, सभी ठीक है, परवाह नहीं।
I've become active now compared to before. I was very weak when I used to do my dialysis somewhere else. Once I started doing here, the machines they use and the dialyzer they use, these dialyzers are not available anywhere else.
Patients who are diagnosed with end-stage renal disease often feel it's the end of hope and it's the end of their lives. But at DaVita NephroLife, with our holistic care model and our concern for patients and care that we take, we believe there will be many years of meaningful life ahead for our patients and they will lead fulfilling, high-quality lives and continue to enjoy laughter and wonderful moments with their families.
Diet plays a very major role for the renal disease. So especially during the hemodialysis, they need more care and moreover they need to learn about diet. So we educate them on how to manage their diet to achieve their nutritional status.
I've introduced relaxation techniques, a little bit of yoga. I'm planning to introduce music therapy for patients, which I often find is very, very helpful. I'm trying to look at a spiritual angle as well, as far as treatment is concerned and counselling is concerned.
We also provide transport facilities for the patients who require pickup and drop for their needs.
On alternate day dialysis, they have to be here and spend half a day. And if there is nobody at home to look after them and accompany the patient, and with this transportation, many families, many patients are happy with it. We take care of them completely. Our drivers goes to their doorstep, pick the patient, do dialysis over here, and even billing is also bedside and drop them back home safely.
Sometimes I feel very tired and weak, but it is, I feel the atmosphere and everything is very good there. The nurses are so good to me and the doctors are very good. Every time they come and ask the question, they check everything.
Certainly I see a lot of changes in him because I think the people are more caring and they are very friendly. Doctors are very good. It's a friendly environment.
Our units are all supervised by doctors. So we have a 24 hours availability of nephrologists to take care of patients, which is unlike the situation elsewhere in the country where you find dialysis units being run only by dialysis technicians, where obviously you find the quality of care is poor. People are being dialyzed for 3 hours, for 2 hours, at whims and fancy of whoever is the technician who's running the program. And doctors get to see the patient once in a month or once in 2 months and so on and so forth, which is probably not very good for the health of the dialysis patients.
We look at conditioned spaces for the dialysis area and do not compromise on the atmosphere inside the dialysis areas, so that the patient spends 3.5–4 hours in a very ambient, cheerful, lively atmosphere.
In other hospitals, they put one television and all the patients have to watch the one channel which they put. In here, the individualized TV facility is there, so we can watch whatever channel we want.
Then we have a good world-class qualified and experienced team here that makes the patients comfortable in dialysis.
Everybody speaks about quality, but what quality we provide is like from the water to the treatment to the patient care, everything plays a very important role in this place.
I am coming here as enjoying only. I am not feeling very disturbed.
The environment, the care, the personalized attention that we receive is really very good. It makes us comfortable, as patients of a very serious ailment. We find that we need that, and it only adds to our confidence.
I believe in a principle what is said as adding life to the human beings in an illness rather than prolonging the years.
And I have been as a dialysis technician since 1998, and I have been to many places and countries and worked in the same field, and I feel proud to be a part of DaVita NephroLife.
So apart from dialysis, ours is also an organization that provides a 360-degree nephrology care, meaning we also provide other forms of renal replacement, namely kidney transplantation, peritoneal dialysis, general nephrology care, and then preventive nephrological aspects.
We have 2 centers in Andhra Pradesh, 3 centers in Chennai, and 1 center which is being under progress at Pondicherry, and we have around 6 centers in Bangalore with a flagship, and we have just tied up with one of the good hospitals in Delhi as well.
The growth has been amazing, and we make sure that this growth trend continues for next 5 years.
I think it will capture many more cities, many more areas dialysis, because CKD, that is chronic kidney disease, is a very, very rampant it is a rampant epidemic. It's a non-communicable disease.
Our organization is helping the community in the form that we are coming up with the multiple centers in all over the places, and even at the remote places wherein availability of a good multi-speciality center is difficult.
The team at NephroLife is a very young team, and they have come from very reputed organizations. They bring their value and standards.
Best thing I love about this team is everybody work for each other. There's no boundaries functional wise, and whenever you need, everybody is there to help you.
Most of the people keep asking us, good that you are associated with DaVita. You are known everywhere. We keep hearing about you. We keep seeing your photos. We are updated with everything what you people do. So that makes us very happy.
One for all.
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 One for all. One for all.